Bismillahirrahmanirrahim. I am Dr. Saima and today we will discuss respiratory volumes and capacities. There are four basic volumes: tidal volume, inspiratory and expiratory reserve volume, and residual volume. Mnemonic: TB is every reminder. Tidal volume approximately 500 milliliter. Air you breathe in or out, normally during rest. Basis for setting ventilator volume in mechanical ventilation. Reduced TB indicates restrictive pattern or shallow breathing, for example, neuromuscular weakness. Inspiratory reserve volume approximately 3000 milliliter. Extra air you can breathe in after a normal inspiration. Reflex strength of inspiratory muscles. Decreases in restrictive diseases like pulmonary fibrosis. Expiratory reserve volume 1200 ml. Extra air you can breathe out after a normal expiration is expiratory reserve volume. Used to assess expiratory muscle strength. Decreases in obesity, pregnancy, and restrictive lung diseases. Residual volume approximately 1200 ml. Air left in lungs even after forceful exhalation. It prevents lung collapse. Increases in obstructive lung diseases due to air trapping, COPD, asthma. Prevent alveolar collapse, essential for gas exchange even at end expiration. Residual volume cannot be measured by spirometry, requires helium dilution or body plethysmography. Lung capacities is combination of volumes: inspiratory capacity, functional residual capacity, vital capacity, and total lung capacity. Mnemonic: I found very tall lungs. I found inspiratory capacity, total air you can inhale after a normal inspiration. Inspiratory capacity is tidal volume plus inspiratory reserve volume. It is reduced in restrictive disorders. Monitored in asthma and COPD to assess improvement after bronchodilator therapy. Vital capacity: maximum air you can exhale after a deep inspiration. Vital capacity is tidal volume plus inspiratory and expiratory reserve volume. Used to evaluate respiratory muscle strength in neuromuscular diseases, for example, myasthenia gravis. Decreases in restrictive disorders, fibrosis, scoliosis. Changes in vital capacity and functional residual capacity help guide ventilator management and disease severity. Total lung capacity is total air lungs can hold. Includes all four volumes. It distinguishes between obstructive and restrictive lung pathologies. It increases in obstructive diseases, hyperinflation, decreases in restrictive diseases. Functional residual capacity, air remaining in lungs after normal exhalation. Functional residual capacity equals expiratory reserve volume plus residual volume. It keeps lungs open at rest. At functional residual capacity, there is no airflow. Equilibrium is maintained between lung recoil and determine lung compliance and gas exchange efficiency. Decreases in restrictive diseases, obesity, when supine. Increase in obstructive disease, COPD. Obstructive disease, COPD, asthma, residual volume increased, FRC, TLC increased due to air trapping. Restrictive disease, fibrosis, all volumes decreases, especially TLC and vital capacity. Aging, residual volume increase, vital capacity decrease because of loss of elastic recoil. Thank you for watching. Subscribe for more videos.